Hello students, welcome to the lecture on healthcare sector in India, and after this lecture we will be able to learn the following objective. Understand the overview of the Indian healthcare sector, define the key trends and drivers in healthcare, explain the medical infrastructure development, discuss the healthcare outsourcing. Let's start with the introduction. Health and healthcare need to be distinguished from each other for no better reason than that the former is often incorrectly seen as a direct function of the latter. Health is clearly not the mere absence of disease. Good health confers on a person or group's freedom from illness and the ability to realize one's potential. Health is therefore best understood as the indispensable basic for defining a person's sense of well-being. The health of population is a distinct key issue in public policy discourse in every major society, often determining the deployment of huge society.
Witness the entire healthcare community come together to recognize the best medical service providers in India at the most authoritative platform in the country. ICICI Lombard Health Insurance and CNBC TV 18 present the Healthcare Awards 2010, where the nation's best healthcare service providers chart the road ahead for putting India on the globe.
Let us now discuss overview of the Indian healthcare sector. The Indian healthcare delivery market is estimated at INR 935 billion and employs over 4 million people, making it one of the largest service sectors in the economy today. This includes the pharmaceuticals market, government and private spending. There are various gaps in the Indian healthcare market which also present a vast opportunity. Good healthcare in India is an extreme short supply. Hospitals in India are running at 80 to 90% occupancy. Segments in health sector. It comprises of many segments like medical infrastructure, medical equipment, health insurance, training and education, telemedicine, clinical trials, etc. Medical infrastructure current state. Current hospital beds per 1,000 population stands at 1.11. Most private hospitals operate as a proprietorship or partnership business. Corporate hospitals account for approximately 10% of the total private ownership. Use of technologically advanced diagnostic equipment and excellent infrastructure are making India a medical value travel hub. Special economic zones. Under the SEZ Act 2005, healthcare has been defined as an approved service for a sector-specific zone. A hospital with minimum bed strength of 25 is stipulated and thus goes up to 100 beds for a multi-product SEZ. With the latest approvals given by an interministerial board of approval, the total number of formally approved SEZ is now at 395, of which 154 have been notified by the Law Ministry. Manpower statistic. Number of doctors 6,60,801. Number of nurses 13,71,121. Medical education 1.229 recognized medical colleges, of which 106 were established through the private route. 2.25000 medical graduates pass out each year. 136 medical schools admit more than 6,000 PG trainees in their programs. Policy Initiative National Health Policy 2002. The National Health Policy 2002 focuses on the need for enhanced funding and organizational restructuring of the national public health initiatives in order to facilitate more equitable access to health facilities. The focus is on those diseases that are principally contributing to the disease burden: TB, malaria and blindness from the category of historical diseases, and HIV/AIDS from the category of newly emerging diseases.
Hi, I'm Howard Young from Europe. I've just had a successful surgery done on my damaged knee in India. It cost me just 1/4 of what it would cost me back home. Plus, my wife and I are enjoying this holiday as well. The Indian doctors and the medical and surgical services are of a rare and high quality.
Incredible India. global healthcare destination, offers you state-of-the-art medical and surgical procedures at unbelievable costs. To cure with care is our...
Let us now discuss key trends and drivers. While rising incomes and growing literacy are likely to drive higher per capita expenditures on healthcare, the shift in disease profiles from infectious to lifestyle-related diseases are expected to raise expenditures per treatment. Lifestyle-related diseases are typically more expensive to treat than infectious ones. In 2001, the average inpatient cost for lifestyle-related diseases, cardiac problems, digestive issues, etc. was INR 32,900 compared to INR 4,550 for infectious diseases. Growing middle class and patient preferences. There is favorable increase in percentage of working class population from 32% in 2006 to 36% in year 2016. Awareness towards preventive health care. Increasing health consciousness among common people has created avenues for preventive health care. Hospitals have started witnessing a number of patients who visit for health checkups as a preventive measure. Increased life expectancy and an aging population. In the domestic market, health spending will be sustained by two demographic trends: increased life expectancy and an aging population. Life expectancy, which averaged 63.3 years in 2000 to 2004, is expected to increase to 65.1 years in 2005 to 9 and to 66 years in 2006 to 10. The proportion of the population aged 65 years and over is also on the rise and will increase from 4.7% in 2000 to 5.3% in 2005 and 5.8% in 2010. Overburdened health, infrastructure and high costs in the West. The healthcare systems in Europe and the United States are under severe pressure, particularly the National Health Service (NHS) in the UK, which has a long list of patients waiting for over a year for surgery. India's value proposition goes far beyond cost quality, second to none. Cost is not the only factor weighing in India's favor. Escorts Hospital, for instance, is one of the only handful treatment facilities worldwide that specialize in robotic surgery. The death rate of coronary bypass patients at Escorts is 0.8%. Healthcare players now targeting smaller cities. Increasing focus on unexplored regions of India in terms of healthcare. Growing need for improved healthcare infrastructure in Tier 2nd and 3rd cities. Better access owing to development of new national or international airports, example Visakhapatnam, Nagpur. Health cities. The evolving concept of healthcare in India. Major corporate hospital groups in India are making significant investment in setting up state-of-the-art health cities in major Indian cities. Around 15 to 20 health cities are expected to come up in India in the next 5 years. Pathology labs. Presently, the lab testing market is largely serviced by small unorganized players and hospitals. Believing that diagnostic is a high-margin and asset-intensive business, many focused players are in the process of developing national networks such as Dr. Lal's Path Labs, Metropolis, SRL Ranbasi, Tharocare and Nicholas Pramil. Impelling technology. Life cycles of high-end medical equipments becoming shorter due to a high level of innovation, telemedicine being used by major healthcare providers to provide quality care, especially in eye, cardiac and other surgeries for the rural poor in India. Teleradiology being used to leverage the time difference advantage with other developed nations. IT-driven tools and services in healthcare. Hospital management system, decision support system that improve diagnosis and treatment, telemedicine and electronic record genera. Biotechnology. Indian companies are driven to innovative research and are establishing their own niche areas. Reliance Life Sciences is planning to launch genetically engineered skin. Avasthogent has won a US patent for multiple-use genetic modification technology. GlaxoSmithKline Biological has plans to launch a number of vaccines like new generation DTP, rotavirus and cervical cancer for its global portfolio. Mergers and acquisition. The M&A route allows healthcare providers with immediate brand recognition and an aggressive scale-up in new geographies. With M&A, new standards in healthcare services have been ushered in by large corporate hospitals. Merger of smaller hospitals and nursing homes with larger healthcare entities has led to better healthcare service delivery. Singapore-based Parkway Group Healthcare Pte Limited has firmed up plans of acquiring tertiary care hospital projects in Class A and B cities of India, especially in the south, with one operational in Hyderabad. The Asian Heart Institute, Mumbai, plans to invest INR 366 million for expansion activities and is actively exploring acquisition targets outside Mumbai. Apollo Hospitals manages a network of 41 specialty hospitals and clinics with a bed capacity of over 9,000 across the country and abroad. Besides the recently launched Health City in Hyderabad, plans to launch similar facilities pan-India. Has tied up with insurers like BUPA UK, Van Breda, Belgium and Modelled Friends to direct inflow of foreign patients to India. Fortis Healthcare has a chain of hospitals with an installed bed capacity of about 1,790 beds. Operation across North India, Delhi, Noida, Mohali, Amritsar, Faridabad, Raipur and Srinagar. Expansion plans through mergers and acquisition. Wockhardt Hospitals. 8 hospitals across India, of which 5 are owned. Total bed size of the group is 1,390. Has tie-ups and association with Harvard Medical International USA, Blue Cross and Blue Shield USA, Bupa, UK, AEA International, Singapore and others. Manipal Health System chain consists of 9 primary centers of 7 rural location, 8 secondary hospitals at urban and semi-urban location, 3 tertiary hospitals at urban and semi-urban location. Narayana Rudayala, first of its kind cardiac care hospital in Bangalore set up by the Asia Heart Foundation AHF, capability to perform 25 major heart surgeries and over 20 cardiac categorization a day. Max Healthcare. The MHC operates 8 healthcare centers in the National Capital Region NCR, bed capacity of around 765 beds and is expected to increase to 1,500 to 1,600 beds in the next few years. Collaborated with Singapore General Hospital in the areas of medical practices, nursing, pharma medical, research and training. Global Hospitals. The INR 487.5 million facility functioned from 2 locations in Hyderabad. Invested INR 1,829 million to set up BGS Global Hospital in Bangalore. Tied up with the Surekha Group to set up a 300-bed transplantation and tertiary care center in Kolkata. Medical infrastructure development. Medical infrastructure forms the largest portion of the healthcare pie. The current bed per 1,000 population ratio for India stands at 1.03 as against an average 4.3 of comparable countries like China, Korea and Thailand. Our analysis points out that in spite of the phenomenal growth in the healthcare infrastructure, we are likely to reach a bed to 1,000 population ratio of 1.85 and in a best case scenario a ratio of 2 by 2012. Beds in excess of 1 million need to be added to reach a ratio of 1.85 per 1,000. Out of the total, about 8,96,500 beds will be added by the private sector with a total investment of INR 2,22,000 crores over the next 6 years. Real estate players in healthcare. The DLF inking a 26:74 joint venture with Fortis Healthcare for setting up hospitals in its 200-acre plus integrated townships across the country at an investment of around INR 75 billion. The JV plans to set up a chain of 200 to 450 bed hospital in 31 cities in India within 3 to 5 years. Fortis Lucknow Medicity is being set up in Ansel's 1,500-acre upcoming mega township. Status of private investment in India's healthcare sector. Growth in private investment in various forms: private equity, acquisition, FDI, FII, NRI investment, joint ventures, tied-ups, venture capital, IPOs. Segments attracting private investment include diagnostic chains, medical device manufacturers and hospital chains. Medical equipment. Medical equipment forms another promising opportunity within healthcare. Our analysis pegs the medical equipment industry at INR 9,790 crore in 2006, growing at 15% per year, and will reach INR 22,396 crore by 2012. Currently, over 65% of the medical equipments are imported, and thus is a key area for forging partnerships across borders. Health insurance. Growing demand for high-quality healthcare has led to growing demand for health insurance. More number of insurers is promoting insurance policies that provide comprehensive health coverage. Multiple channels, including banks, are being used to sell group and individual health insurance policies. Three factors have changed the face of the medical insurance market. Privatization in 2000, ending the monopoly of the public sector. Introduction of third-party administrators, TPAs, by the Insurance Regulatory and Development Authority in 2002 has made the medical insurance segment more attractive through provision of cashless hospitalization facility. New products in health insurance. The ICICI Prudential is looking at introducing a policy where the premium will remain the same year after year irrespective of the age of the policy holder. Introduction of crisis cover by insurance companies, which provides for payment on detection of any of the 35 diseases covered. Medical value travel. Medical value travel is one of the most lucrative segments of the healthcare sector. Potential to contribute INR 60 billion additional revenue for upmarket tertiary hospital by 2012 and will account for 3 to 5% of the total healthcare delivery market. Hospital planning and consulting. Special skill sets required for orchestrating a hospital projects from ideation to implementation. Major hospital chains are now hiring hospital planning consultancy firms for a better and faster scale-up of their facilities. Medical textiles and clinical trials. Medical textiles. Indian market for medical textile is worth INR 25,000 million. Global market is worth INR 410 billion. Growth in medical infrastructure will be accompanied by demand for associated products and services. One such important industry is medical textiles. Clinical trials. Indian clinical trials market in 2006 was INR 7,000 million and is growing at a CAGR of 40% for the last 3 years. Several hospitals are setting up clinical trial centers. Healthcare outsourcing. India has an estimated share of 65% in the global IT services offshoring segment and around 46% of the global BPO market. Medical services outsourcing from the US has seen a CAGR of 150% in the last 2 years. Indian service providers accounted for INR 5,750 million worth of outsourcing and offshoring services during 2005 to 6. Factors making India the preferred destination for healthcare outsourcing. HIPAA compliant processes, AAPC trained medical coders, thorough understanding of US medical coding and billing procedures and processes including government regulation. Healthcare BPO services, medical coding, medical billing, patient demographics, charge entry, payment entry or cash posting, claims processing, accounts receivable, teleradiology, medical transcription, patient record management in EMR, electronic medical record.
At V Technologies, we pride ourselves on the most reliable, trustworthy processing in the industry. Being part of Sona University, we have knowledge intertwined in our DNA. The patient is the focus of everything we do. From information gathered at the doctor's office through the EMR process, V is totally involved. Patient information, symptoms, diagnosis, treatments, EOBs are all sent to the billing office. We take the manual out of the point of interaction. The most crucial part is the coding. This is what separates V from all the rest. At our Sona University, we have a coding school, which trains coders and customizes their knowledge to client categories, like cardiology and respiratory. This way, they are custom sculptured to a client requirement. Our entire coding department is certified ICD-9 coding and trained in ICD-10. ICD-10 has been the coding system in India for the past 5 years. Here, our coders are trained in every aspect of the rules and regulations that govern the healthcare procedures. This plays a major role in increasing collections. The billing cycle at V is second to none. What V does in 2 hours, other billing companies take nearly 100 hours. All the processing of the provider runs into one central place. It is done within a secure environment. As the reimbursements in the industry are going down, the speed required to get bills out is key. V-Bill is a billing solution built around rapid delivery. V's knowledge-led advantage, along with LMS integration, allows our 5 Sigma operator to reach 6 Sigma levels. This unmatched expertise makes our process virtually error-free, and that reduces the payment time for providers from 60 days all the way down to 30 days, an advantage that is unparalleled in the industry. Lots of companies say they are HIPAA compliant, but V is HIPAA certified and is ISO 27000 certified for security as well. We are also highly versed in the requirements of the new HIT Act. After this information is gathered, both at the provider's billing office and ours, we will then proceed to the patient registration payment posting, which involves the clearinghouse and procedures with the insurance company. If a payment is denied, that's when our accounts receivable department takes over. Here is where V really shines. For our AR department is a team that is totally dedicated to accounts receivable. Most companies have processors that do several jobs and can't dedicate themselves to chasing after the payer. After 10 years working for insurance companies, we have a deep understanding of what helps a bill pass more efficiently. It's not beating the system, it's expediency by knowing the rules of the game. Because we have a dedicated AR department and an industry-leading healthcare data repository, we can analyze the bill and pinpoint why it's denied. This helps us get the payer to pay and the provider paid.
Challenges to private investor. Although private investment are growing in various segments of healthcare sector, longer-term direct investment not as forthcoming as PE, IPO and VC-based investment. Regulatory, infrastructural, human resource and other constraints are affecting direct investment. A primary study conducted in 2007 funded by WHO and Ministry of Health on foreign investment in hospitals, status and implication illustrate a range of challenges affecting organic investment in the Indian hospital segment. Findings on foreign investment in Indian hospital. Regulatory environment very liberal for foreign investment in hospitals. Since January 2000, up to 100% FDI allowed under automatic route in hospitals in India. Regulatory environment for other forms of foreign financing quite liberal. FLLS and private equity funding permitted under FDI with certain condition. FLLS and private equity funds can individually purchase up to 10% and collectively up to 24% of paid-up share capital of company via open offers or private placement or through stock exchange. Proprietary funds, foreign individuals, foreign corporate can register as sub-account and invest via F11 subject to 10% and 5% limits. Foreign venture capital investment also allowed. Status of other forms of investment, non-debt-based foreign financing present via private equity funds with stakes of 15 to 26%, development agencies, investment arms of foreign government, around 50% of financing via long-term domestic borrowing. Challenges, external constraint. Healthcare undergoing reform and internal problems in overseas economies. Number of potential players who could invest as limited. Requirement of localized and in-depth knowledge of host country market, difficulties in setting up individually as an overseas investor, difficulties in establishing and maintaining joint ventures, competing destination, lower attractiveness of India as an investment destination due to perception of red tape, lack of policy clarity, lack of transparency and problems of efficiency. Domestic constraint. Initial and post-establishment related operational issues adversely affect returns to investment in hospitals in India. Features of investment make it unattractive for foreign investment. High cost of setting up hospitals and capital intensity, land, equipment, long gestation period of such investment, relatively low returns on such investment, low asset turnover, profits of 13% or less after several years. Depreciation of assets, high interest cost of debt financing, margin squeezed by very high operating costs. Now, in the end, let us summarize what we have learned in this lecture. Good health confers on a person or group's freedom from illness and the ability to realize one's potential. The National Health Policy 2002 focuses on the need for enhanced funding and organizational restructuring of the national public health initiatives in order to facilitate more equitable access to health facilities. India has an estimated share of 65% in the global IT services offshoring segment and around 46% of the global BPO market. The private healthcare sector in India accounts for over 75% of total healthcare expenditure in the country and is one of the largest in the world. Indian market for medical textile is worth INR 25,000 million. Global market is worth INR 410 billion.